And if you look at the problem of scoliosis, we have to have a normal understanding of the alignment of the spine. So if you look at the spine from behind, so what we call in the frontal plane, it's absolutely straight. So if you look the spine in profile, it has this S-shaped curvature. Profile means, if you look at the spine from the side, it's in S-shaped. So if there are any deformities of the spine in the frontal plane, that means it can bend towards one side. Normally in the frontal plane it is straight. So if it bends towards one side, that is known as scoliosis. So what are the types of scoliosis? If you look at the types of scoliosis, so based on the age at which we make a diagnosis, it's kind of classified into different types. So one is known as an infantile scoliosis. If you see the scoliosis, sideward bending of the spine below the age of 3 years, then we say an infantile scoliosis. And if it is between 3 and 9 years, we call it a juvenile scoliosis. Above 9 years and below 18 years, it is known as adolescent scoliosis. And if it is above 18 years of age, then we say it's an adult scoliosis. So based on the age at which we make a diagnosis of scoliosis, we call these infantile scoliosis, juvenile scoliosis, adolescent scoliosis, and adult scoliosis. So let's look at what can cause scoliosis. What are the causes of scoliosis? Most of the times, 85 to 90% of the times, we do not know what is the cause for the scoliosis. So that type of scoliosis is known as idiopathic scoliosis. So the cause of scoliosis is unknown, then it is known as idiopathic scoliosis. Sometimes there are problems in the development of the bones in the spine. These bones are known as vertebral bodies. So if there is any failure of formation of these bones, or if there is failure of segmentation, what we call, or a combination of failure of formation and failure of segmentation, so it can cause anomalies of these vertebral bodies that can lead to scoliosis. Let me put this in a very simple words. So if there is any problem in the development of the bones, that can lead to scoliosis. So that's another cause. So there are other different causes of scoliosis, like what we call post-traumatic scoliosis. So patient met with an accident and there is fracture of the bones in the back, and these bones are kind of not united in a proper position. So that can lead to scoliosis. So that is known as post-traumatic scoliosis. And sometimes the post-infective scoliosis. So if there is an infection in the spine, for example, there can be tuberculosis of the spine, which can lead to destruction of the bones in the back. So that can lead to scoliosis. And the other important cause is if there are any tumors in the spine. Say for example, there is a tumor known as neurofibromatosis. So that can give scoliosis to the patient. So if there are any birth anomalies of the spine, if it is any injury to the bones in the back, or if there is any infection and that infection is not treated properly, or if there is any tumor, so that can lead to scoliosis. And the other most important cause for scoliosis nowadays we are seeing most commonly in our clinic is what we call adult scoliosis. So as the age advances, the degenerative changes, the aging changes set in different parts of the spine, like the aging changes set in the intervertebral disc, aging changes set in the facet joints, the joints between the two bodies, and again as the aging process takes place, there is loss of calcium from the bones. All these changes put together, degenerative changes in the disc, degenerative changes in the facets, and loss of calcium from the bones, all these things can lead to bending of the spine in the elderly people. So this is what we call an adult scoliosis. So these are the causes of scoliosis. But if you see, the most common type I mentioned is known as an idiopathic scoliosis, and this type of scoliosis is seen in children between the ages of 10 and 15 years, and this is more commonly seen in girls compared to boys. if you look at the ratio of girls versus boys, so if 10 girls are affected, only one boy is affected with this scoliosis. So most common type of scoliosis is idiopathic scoliosis seen in girls between 10 and 14 years of age. So what happens to this type of scoliosis? As the child grows, the sideward bending also grows, and most of the times people are not coming to the doctors because it doesn't, most of the times it doesn't give any symptoms like any pain, difficulty in walking, or difficulty in passing urine or motion. It doesn't give any complaint, just the cosmetic deformity. And in this age group, between 10 and 14 years age group, especially in girls, a lot of physical changes take place, and most of the parents, they mistake this scoliosis as kind of development. So once the patients come to us with the scoliosis, so what we do is we take an X-ray, and this X-ray is usually taken in a standing position. So once we take the X-ray, we know whether the patient has scoliosis or not. So if there is scoliosis, we measure the severity of scoliosis on the X-ray in what is known as the Cobb angles. So the angle between the two vertebral bodies in scoliosis, so we call it a Cobb angle. So if the Cobb angle is less than 25 degrees, we call it a mild type curve. So if it is between 25 and 40 degrees, we call it a moderate type of curve. And if it is more than 40 degrees, then it's a severe form of curve. So depending on this Cobb angle, we take a decision how to treat the scoliosis, especially this idiopathic type of scoliosis. If it is a mild form, that means if the Cobb angle is less than 25 degrees, we don't do anything to this, so no treatment is required. But what we do is we periodically follow these patients. Periodically means once in every 6 months, we ask the patient to come back, take the X-ray, see if the curve is progressing or not. So this is the treatment for mild type of scoliosis. But if the curve is between 25 and 40 degrees, we say it's a moderate type of scoliosis, and these are the patients who require what we call a brace treatment. So brace or belt treatment, and we offer this brace treatment till skeletal maturity. That means patients attains full growth. So, and the children, they have to wear this brace for a minimum period of 18 hours per day. So, and coming to the severe form of scoliosis, so it cannot be corrected by the medical measures like the physiotherapy, the braces. So if it is more than 40 degrees, we have to operate, correct the scoliosis. So if you look at the aims of corrective surgery in scoliosis, the first aim is to prevent the progression of the curve. So what happens if you leave this curve after severe curves, they progress slowly over a period of time, and the spine can become really crooked. So the primary aim of doing surgery is to prevent progression of the curve, and the second aim is to gain what we call spinal balance. One of the functions of the spine is to maintain the balance of the body. So what is the balance of the body? The balance of the body means the spine keeps the head in the center of the pelvis. If the spine is bending towards one side, so what happens is the head is tilted towards one side, either right side or left side. So we try to achieve a balance of the spine by doing surgery. And third one is of course to straighten up the spine as much as possible. And a lot of misconceptions we keep hearing from a lot of my patients. The scoliosis surgery is a very, very safe surgery, and with the advent of modern technologies like the neuromonitoring, this neuromonitoring helps us monitoring the function of the nerves during surgery, so that avoids any injury to the neural structures. So the misconception of paralysis after surgery won't be there. The paralysis problem won't be there after surgery if we use neuromonitoring during surgery.